Um, that's really helpful.
Mhm.
On the physical side, I have my own question
Mhm.
about the ramifications or the leftovers of COVID.
Mhm.
Um, so it, I have a huge amount of congestion that's working its way out of my chest,
Okay.
and then it's possible I could still be having a little bit of a drip that's contributing to it ongoing.
Okay.
But if I get a little bit horizontal, I'm just hacking. Um, is there any oil that can help
Yeah. So,
with facilitating it?
yeah, a couple things. Like, have you tried using a Nula at all?
No, but I do
Okay.
have
So,
some.
okay. So, a Nula is one of the strongest mucoleptics in aromatherapy. Like it is, like it helps to break it down and like get it out. Now, sometimes it might not need. I mean, you can try that and see if it brings relief. Especially like in the lung part, it might help. Um in the treatment of, like, you just seem to be like constantly kind of having the moisture and everything. Terebinth will dry things up substantially. And so if it feels like you're just like overproducing mucus, you can't stop it. Like if you're just getting it out, use the Anula. But if it just feels like it's like a faucet's turned on and you can't get it to stop, Terebinth will usually dry that up. It's one of the best things for that in aromatherapy. I would also use, if it's a lot of where, like, even when you're standing up, like the nose is running, Angelica internally can be helpful. But what I would do is I'd probably go in between Anula and Terebinth and see which one works for you better. Just a lot of inhalations. You can even rub a little bit on your chest after you're done. Um, I would try that, and then from the health food store, get some golden seal root. Make sure it's the root, not the leaf. You know, every once in a while, somebody tries to slide past the leaf because it's cheaper, but it's nowhere near as effective. And take like 2 or 3 capsules like twice a day, and between all of that, that should really knock it out.
Okay, so if it doesn't specify, because I was taking Golden Seal, but I didn't realize to look for one over the other. If it doesn't specify, I can assume it's the leaf. If that is that
No,
correct?
it's still probably the root. Yeah, I mean, most times it's the root, and so it's not mixed with anything. It's just by itself.
It's in a capsule.
But it's not with like echinacea or something like that.
No, I made sure to stay away and just
Okay,
get the Golden Seal.
so two or three capsules twice a day, and then um, do you have terebinth?
I'm sure I do. That
Yeah,
sounds so
I'm sure you do
familiar.
too. Like it's been in classes and stuff. And remember,
Yeah.
like you can look up what class it was in.
Oh,
Semantic through that. Yeah,
I've recategorized mine by alphabet.
yeah. Okay, perfect. I would
Yeah.
probably do the two of those together and see how that treats you. And if the terebinth doesn't work, then maybe try the Anula. Yeah.
So is this true also if I am like I don't have headaches and but like I'm not really smelling. I can it's like breathing is is not easy, so I'm pretty sure that I have congestion, like an allergy kind of congestion, and it actually could be partly allergy because a lot of people are
Sure,
complaining about them.
sure.
So would terebinth still be
Still be,
effective?
yeah.
Okay.
Still, you like that combination, be it allergies, just a cold, COVID, whatever it is, it would still be the treatment plan. Because the thing is like it might not dry you up and clean things up like if you took an over-the-counter med or something, but your respiratory tract will be much healthier afterwards, and you'll be more
Yes.
vibrant afterwards. Because you haven't manipulated things so much. I mean, there's a time and place to do that sometimes, but treating it like this is pretty solid. And if it just doesn't resolve itself after a few days, then um, we can step it up a notch, but that usually is what will do it. And then if there's any other symptoms after that, we can just go through it and treat. So, feel free to email us if it's before next Tuesday.
Well, I'm willing to be patient with this. I remember when I got it last year, it was like this, and the
Yeah,
part in my lungs took a while,
yeah,
but
yeah.
I had been heavily, well, I thank you so much for your guidance because I was able to stay away from all the meds
Yeah,
and just strictly use the oils, and
yeah, yeah.
I'm I feel strong immediately
Good.
afterwards, whereas before I was dragging.
Yeah,
So
yeah,
yeah,
yeah.
wish I
Well,
could convince more people.
yeah, I
Thank you
hope
so much.
you're so welcome. I hope you feel better soon.
Thank you. I
And
do.
and
Thank
you
you.
did like a test, it's COVID for sure?
I did not do the test for, I have them, but the tests um, have been, unless you get it the right day and all of that, but it was so much
All the symptoms. Yeah, yeah.
exactly the what I experienced
Yeah,
before, and the fever and the chill, everything.
yeah.
So
And the thing too with the test is there's been so much mutation that I don't
yes,
know that the old tests are even accurate anymore. You know what I mean?
yeah, and there's a lot being written about that, so it's not just
Yeah,
anecdotal. So
yeah.
well, thank you again.
You're so welcome.